Hello, John Canelopoulos. We're seeing here a recurrent epithelial erosion, map.fingerprint or anterior basement membrane dystrophy treated with, as we can see here, removal with EBK of the epithelium. We can see how fragile the epithelium in the inferior part of the cornea. We're using the blunt crescent to complete after the EBK device by ORCA to complete the epithelial removal, so we can use our excimer laser to remove just 10 microns from Bowman's membrane. One thing to pay attention to is that Bowman's membrane here in this disease is not very shiny. So you can tell there's been a lot of activity in epithelial erosion and recurrence. And anybody who's done enough PRKs with epithelial removal can tell that this Bowman's looks a little bit more cloudy than usual. We're setting up our EX500 excimer laser. As I mentioned before, it's set at 10 microns of PTK done. And now we're going to come in, since this is a very small ablation, and use amnion. We use the BioGenTek dried amniotic membrane. It's an amniotic membrane disc, 50 micron thick, and we'll see here the box. This is our go-to product for many years. It's 12 millimeters in diameter, and we'll see how very easily, and we want to grasp with a toothless forceps the amnion. It is very nicely prepared by our BioGenTek team. It has a central orifice, which helps a lot into helping it stick to the surface, as some of the surface fluid will come out of the central orifice. And for the first time, we're showing here in doing this in combination with a collagen shield. Collagen shield will play the role of a grid that will keep the membrane in place, and over the shield we'll place a bandage contact lens. And as we'll see here, we have good absorption of dehydrated membrane, amniotic membrane on the surface of the epithelialized cornea. And of course, we're using amnion here to help with pain and accelerate epithelialization, which happened in this patient in under 4 days. We usually wait 6 to 7 days to epithelialize. We hydrated here the Oasis collagen shield, placed over the amnion, and then over that a bandage contact lens to complete the procedure. We're going to see another procedure of similar facility. Here's our bandage contact lens, and we're going to see immediately after OCT images that will clearly see the cornea, the amnion, that very thin hyper-reflective membrane, the really wide thick area is the collagen shield, and then the bandage contact lens. Here is a keratoconic patient. We'll see our classic Athens Protocol procedure. Here, anterior segment OCT showing the epithelial remodeling, and now we're starting with the topographically guided treatment first on bare epithelium, and then with the PTK as a second step, 35 microns, 8 millimeters diameter. And as the two are added, we'll have a added effect of the normalization. Riboflavin will continue with 15 minutes of 6 milliwatts, and as we finish, we'll do the exact same thing. Dehydrated amnion disc by BioGenTek. We'll place it on the now cross-linked cornea, which had undergone through a surface normalization excimer ablation, and then our Oasis collagen shield, which, as I mentioned before, after rehydrated, will be placed on the amnion, will work as a grid that will trap the amnion in place and help with it being retained by the bandage lens. So the collagen shield, the bandage lens will follow here as well. And then we'll see immediately postoperative images as we saw before, removing here the speculum following our bandage lens. Here's the bandage contact lens. We're using afloxacin, bromfenac for pain control, and corticosteroids, obviously, dexamethasone in Europe, predforte in the US. So removing gently and here's immediately post-op, again, the amnion, the really fine white line, the collagen shield, the thick white layer, and then the bandage contact lens on top. And this is now 3 days later. The collagen shield has melted away, but the bandage lens and the amnion is in place. So this is our technique, this is our proposition for faster, painless recovery of surface ablation of any type. John Canelopoulos signing out. Thanks very much for your attention.